you. Thank you so much for that introduction. Hello, everybody. It is such a pleasure and an honor to be here with you today and to share in this space, and especially to be able to share my work, what I do, and what I'm really, really passionate about. So today's session is entitled EDI and Research Impact. That encompasses a lot. I'm going to try to squish quite a bit of information for you into about the 40 minutes that I'm going to be presenting to you. I do want to tell you a little bit about myself, just a little bit about my background. So, you've heard my role as Director of EDI and Research and Innovation. It's a new role now. I've been in it for about 17 months here at U of T. It was an inaugural role, so a new role to the field. As well. And the big push for this support at the institution really came from an understanding, and I feel like a big realization within academia, that equity, diversity, and inclusion and aspects of and frameworks of these have been missing from our research spaces. It has led to what we see today as a huge lack of diversity in senior leadership and management roles and in faculty representation. And two, issues of EDI also explains a lot of the experiences that students, trainees, and so on have within academic spaces, especially those who are from underrepresented groups. And so basically my job is to examine those experiences, examine the systems and the structures that impact individuals from underrepresented groups in these academic research spaces, and then to develop strategies to mitigate for them. It's a big mouthful for what I do. I do this work with a lot of folks here at the institution. I'm very fortunate to have a wonderful team of EDI directors across the institution. Also at central offices, our director executive director of EDI as well, Jody Glean, supports me quite a bit. And, we have a number of experts as well in different offices doing a lot of the work of anti-racism, accessibility, gender and sex support, sexuality support as well at the institution. And so I work with these individuals as well that inform a lot of my work. By no means am I an expert. I will never be an expert. I don't think anyone could ever be an expert in EDI. And so I always acknowledge my positionality and that I'm only limited to my understanding of the world and the lens that I bring. This is a big part of the work that I'm about to present to you as well, where I will essentially be challenging you on your own positionality in your work and in what you're doing. So welcome, and let's get going. So I guess just a little bit of my research background as well, so sort of where my lens and the aspect of what I'm going to be presenting to you as well today comes from. So I did my undergrad in athletic training in the States, and I actually worked as an athletic trainer with athletes for a while too, before moving to Canada. I came as an immigrant and to do my graduate studies at Western University to do my master's in kinesiology. Finished my master's there in kin, and then went straight into a PhD in health and rehabilitation sciences. My research work actually is based in sports medicine, and my PhD work, or I guess field of emphasis, was measurement and methods. So I really love research design, data analysis, not like too much like a statistician or a biostatistician, but, touching on it and making numbers tell us a story. And so, this again too has contributed to so much of my understanding of how to think of EDI in the research environment and in research design as well. And then sort of along the way, a little bit about my career journey, how I kind of came to where I'm at today. So I completed my PhD, and then I actually entered into an administrative role at the institution, first as a research ethics officer, and then as a research development officer. I worked in research development for a while, and it was around about that time, probably in about 2017, when this huge push came down from the federal government through the funding agencies and grant requirements that researchers needed to have an EDI component to their research applications. It was a crazy time because everybody started scrambling. Nobody really knew what EDI was or how it, comes to research. We've always prided ourselves in research is objective, we are separate from this work. But the reality is that we're really not. And that's really so much of what I learned early on in this journey, that we are not separate from the work. even numbers can be manipulated depending on the lens of who is looking at those numbers. And so this is why I think that EDI and research and innovation and thinking of it from that perspective is so important, because research itself has done so much harm in our world. You know, we talk about using evidence-based practice in the work that, you know, in the areas sort of outside of the institution so much in policymaking and, you know, healthcare and our education. But we never really question how equitable, diverse, and inclusive is that knowledge development that we then take in as evidence, right? And so this is where this field that I'm working in at the moment really queries questions and ensures, provides accountability for that work. I ended up kind of doing this work, and like I said, kind of got thrown into it around the time when all these EDI requirements came down. And that's when I decided to actually go back to school again and do a master's in women's studies and feminist research. I wanted to understand the theoretical reasons, the theoretical frameworks as to why we were seeing the issues that we were seeing. Not only was I informed by what I was seeing on a daily basis by trying to support researchers, and especially those from underrepresented groups, but also because of my own personal experiences as a woman identifying Black, immigrant, first-gen graduate student myself. It was interesting, you know, we go through this graduate experience and we're told just, you know, put your head down, keep working hard, you take so much. And so, you know, I empathize with graduate students because I know how hard it is. But oftentimes we also don't question some of the things that happen to us along the way. And especially for those of us who are from underrepresented groups, you know, you just want to be valued for the work that you do. You don't want to, you don't want to see, or we don't really want to know that there are challenges and barriers for us. We just want to know that if I want to be able to attain, if I'm working really hard and if I'm producing, I just want to be recognized and acknowledged for what I'm producing. Unfortunately, that's not how academia works, not always. And so, you know, looking back at my own graduate experience, I realized and saw so many of the issues and the challenges that I faced that, you know, that and the things I had to do to overcome them, that it was like, that's just not okay. And so this is why in my work as well, I advocate for graduate student experiences as well, to mitigate for those, right? To say that it's not okay that graduate students have to, you know, experience so much bias toward them. You know, also just so much abuse sometimes just because they are afraid to offend if they speak up to, because, you know, your career is on the line. If, you know, your supervisor who's a, you know, a leader in their field, if you complain about them or about an experience you're having in the lab, that could jeopardize your future. So I know, I see, and I understand. And so I just want to say that here as we kind of start the session as well. There you go. So before I really kind of get started with the actual presentation, I do want to acknowledge this land on which the University of Toronto operates, where my office is today. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to work on this land. As an individual who works in EDI, not in the work of indigenization, I take the responsibility that I have very seriously to ensure that I prioritize and uphold as well Indigenous sovereignty and rights in the work that I do. So here's a reality check, right? We live in a society of hierarchies. Hierarchies that privileges some identities, some ways of being, some ways of knowing over others. It has come from a history in our country and all over the world of colonization, of oppression, and marginalization of individuals who were either, non-European or considered to be lesser than in our society. And, you know, even when those, you know, when slavery ended, when Indigenous genocide ended, when the residential schools closed, when those policies and laws that continue to oppress people ended, you know, those ideologies didn't just disappear. They didn't just all of a sudden magically go away from the minds of people in these spaces. These ideologies still carry on into our environments and into our research environments today. And so we have to realize and acknowledge that we, you know, in our academic system and in our research system, we work within a system of hierarchy still today, where certain certain aspects of people's identities are valued more than others. In the graphic that you see in front of you, the more you identify with characteristics on the inside of the circle, the more likely you are to be treated well, to be paid more, to receive professional development opportunities, to receive job opportunities, and so on in our society. Unfortunately, we still, even in our academic and research spaces, treat each other based on our lived identities of whether we fit into the inside of the circle or on the outside of the circle. This also impacts what we do and how we do the things that we do within our research spaces, right? Now, we all to some degree, many of us, and if you are sitting on this call right now, you are in a position of power and privilege, right? It is a privilege for you to be sitting here in sort of this academic space with access to, being in this space within itself, right? So, we all carry privilege. And, like I said, even as I'm sitting here in front of you today, I might be an immigrant, first gen, Black woman, but at the same time, I know I hold many privileges as well. I'm educated, I'm English speaker, there's many aspects of my identity that holds privilege as well when I walk into spaces. Now, it's not privilege that's a bad thing, but it's how you use your privilege over others that do not hold that privilege that makes it a bad thing. And so I want you to be mindful of this, to understand your own positionality as well, where you are at and how you use your power and your privilege, and to ensure that you're not using it to oppress others in the way that you are either interacting with colleagues or even in your research and how you're framing and thinking about those who are from underrepresented groups in your work. Now, in understanding the impacts of equity, diversity, and inclusion, history and what has occurred in our history in Canada and globally as well has impacted our current society and the ideologies that we carry there. And this manifests in bias toward individuals, especially those from underrepresented groups, when deficit thinking impacts and creates challenges and barriers for them in these spaces. And this oftentimes leads to the inequity we see in these environments as well, right? Both the quantitative, sort of diversity numbers, but also the qualitative experiences of individuals who are from underrepresented groups speaking to those experiences. And then too, as you can imagine, if that's what's happening in our environment, it impacts our research lens as well. And there's so many examples that, I can kind of bring to you today about how a lack of equity, diversity, and inclusion within research has impacted research and research results. One of these big ones that we've seen over the pandemic especially is the sad case of the pulse oximeter. The pulse oximeter is the little clip you get on your finger when you go to the hospital. And as you can imagine, over the pandemic, it was something that was used very frequently because it measures O2 levels and your heart rate, right? When you go to the emergency room. And that also then determined your plan of care that you would be receiving, such as getting a ventilator or not, while you're at the hospital. Now, what we've known, it's funny because, a paper was written now in I think it was 2020, published by scholars at the University of Michigan that said that pulse oximeters are less valid and reliable for individuals as skin tones darken. So what this means is that if you have darker skin, your O2 level readings and your heart rate readings are potentially inaccurate, which can really significantly impact your plan of care then, right? Access to a ventilator or not access to a ventilator if those numbers are not correct. And so it's interesting because, we've known this actually since the late 90s when the pulse oximeter was developed, but nobody stopped to say we need to take this off the market, because even though it's being used in Africa, in South Asia, and in places where people have darker skin, we need to make sure that we're taking it off the market, and we need to redo these algorithms and revalidate this tool. It's still being used today. Nurses are still using it in our hospitals today. And that's because why? Underrepresented groups just aren't really considered, right? If it doesn't impact the majority, who cares? Oftentimes, even in research spaces, it's too much money, it's too much time, it's too much thinking, too many resources for us to really use EDI in our research lenses. And this is why too, for you all who are here on the call today, I think you have such a huge responsibility in the work that you are doing to ensure that as you continue into your career now, that you really truly consider how your work impacts those. So, a systemic and structural issue needs to take a systemic and structural approach. And that's why in EDI and research, from the aspects of what I'm about to present to you as well, we need to make sure and think about how EDI is impacted by the individual. So your own individual responsibility. This is where I talk about you and your positionality as a researcher. Who are you to your research? Who is your research to you? How do you impact, and your ways of being and knowing impact the work that you do? We need to be aware of this, and we need to also assess this for ourselves as well, right? And then that who we are and who we bring to our work on a daily basis really impacts our organization. It impacts our research team. It impacts our lab. It impacts your unit and your division as well. And then it impacts research and the work that you do. And your research impacts the greater society. So that's why as academic institutions, we have such a huge responsibility to really be thinking about EDI. Now, when we think about how we sort of approach this work, I really like the graphic of this circle because, it really shows us it is a journey, but it is an ongoing journey, a never ending journey. We need to acknowledge that inequity exists. We need to acknowledge as well that, our systems and structures of academia and research spaces have in the past, but also still at the moment, includes challenges and barriers for those from underrepresented groups whom the space was never built for. The academic institution was started as a space for white men to develop knowledge for the world, right? White, cisgendered, heteronormative, able-bodied men to be able to produce knowledge that the world must then adopt. Slowly over the years, women, people of color, people with disabilities, gender diverse individuals, and so on, started getting kind of included, but the challenges still exist, right? And so we need to acknowledge that. We need to also understand our privilege and be aware of it, and how that also impacts the bias, the unconscious bias that we bring into these spaces. We need to be willing to listen especially to those from underrepresented groups in our spaces. And in this way as well, relinquish your power and privilege, right? To make space for these individuals where you are at. We need to ask as well, right? We must never assume. Assumptions is one of the big part of this work as well that I'm going to talk to as well when I talk a little bit more to research design in a minute or so. But, it's important for us to ask, right? And never assume. And then you can really sort of start the allyship journey, right? But it also, like I said, is a continuous work in progress. Now, when we think about EDI and research and innovation, there's really two sort of frameworks, two aspects to the framework that we use. So this was actually provided to us by the Tri-Council to kind of think about it in this way. It's really one that I use as the basis for the work that I do. So in thinking about research, sort of the ecosystem of research, we think about it in two ways. We think about it as the research environment, so the environment within which research is happening, right? The people in it, the environment, the built environment, the social environment within which it's happening. And then the second part sort of to the research ecosystem is the research process. So this is the actual research. So this is, the research question, the methods, analysis, results and interpretation, knowledge mobilization and impact as well. Now, in speaking to the research environment, I'm not going to spend too much time on this one. I want to talk a little bit more to the research process that I'm going to be showing you here as well. But, what's important too, and I'll touch a little bit more on this, is about team composition. Representation in team composition, both in diversity of expertise, but also diversity of identity, lived experience, and backgrounds, is so crucial to this work. The student trainee recruitment and hiring process, I think back to my own experience of being, becoming a graduate student. My process was I actually just kind of went online and I Googled, universities in Canada because I was looking to move to Canada, looking for universities that had my, like a sports medicine program. And then two, on top of that, like I said, being first gen and immigrant, I didn't really have money to pay for school. So I was actually looking for one that had a scholarship with it somehow. And Googled that, and I was able to find one that had a graduate research scholarship. And then I called them the next day to the graduate office, and they said, oh, okay, you kind of qualify, you're eligible, but now what you really need to do to start your application process is you need to find yourself a supervisor in our department. And so what I did was went on the website, found a supervisor that would match up research with mine, called her up, emailed her actually, said to her, I'm really interested in being her graduate student. She said, oh, sure, like your CV, I like the work that you've been doing, let's have a conversation. We had the conversation. She liked what she heard. she said she, offered me an opportunity in her lab. And that's when I started the graduate process. At any time during that process, she could have seen the color of my skin and said, you know what, I don't have any spots in my lab. She could have heard my accent, if I had an accent, she could have said, oh, I don't really understand you very well. And so I don't really want someone with a heavy accent like that in my office. At any time during that process, she could have refused me and I would have had no grounds to say it was discriminatory, right? Because they, within that space, who holds power, who holds privilege is oftentimes the faculty members who choose the trainees that they get to work with, right? And so we know that that process is so subjective, right? There's so much subjectivity leaning into that. And so there's so much space for bias to seep in as well. And, to be honest, it's oftentimes the reason why I see when you look at a lab and you see a homogeneous lab, it's what has led to it, right? It's that affinity bias where we as people have a tendency to want to be with and surround ourselves with people who look like us or culturally reflect us, right? It's a bias we hold. And so you can imagine what happens toward individuals from underrepresented groups when, how do you name that? And so, again, too many aspects of the trainee experience as well that kind of comes with it, mentorship and sponsorship opportunities as well is not always dealt out equitably. And, another aspect too here is the community engagement and outreach as well, right, is another contribution to sort of the research environment. So like I said, we're going to go on to the research process now in this next part of the presentation. Just a couple questions to ask yourself when you're thinking about approaching your research, right? What assumptions are you making about underrepresented groups in your research question? Because the very framing of your research question could actually, especially if it brings into a consideration aspects of people's identity like race or gender or disability status or sexual orientation or so, that if you frame your question in a way, and especially if you are working specifically with a underrepresented group, it could frame it in a way that is framing them at a deficit, right? Or brings in assumptions of stereotypes, right? And so you have to be very careful, even just in how you've asked your question, because the very framing and asking of your research question could be harmful, right? And then ask yourself as well, how is the literature that you're basing sort of your research question and your inquiry on from, right? How has it contributed to this? We know that a lot of work, especially in sort of fields of psychology, specifically eugenics, has perpetuated so much of this deficit thinking that, because they found in research lower cognitive levels, cognitive functioning in Black people, so that it's kind of, that is used in research algorithms now. Within the work that people do. And people didn't realize that that's what they're doing, right? Concussion testing, I encourage you to kind of look up that case as well. But in concussion testing, they used to use race norming. Actually, they still did up until probably about a year or two ago. But basically what that did is that it said that Black people's concussion tests, so the number that comes out, needs to be lowered because they start off with as a baseline as being of lower cognitive functioning than white people. And so therefore, two athletes who both have the same concussion scores, you have to lower the severity for the Black player because Black people are of lower cognitive functioning. I mean, when you think about that, our cognitive functioning is not based on our race and our skin color, right? And so how, kind of racist processes get built into our research and into, the work we do on a daily basis. Also asking yourself, how are you including underrepresented groups in your study population? Is it diverse? Is it not diverse? Is it representative? Is it not representative, right? Also, context matters, but I would also add that culture matters, right? And then does your data analysis approach make assumptions about underrepresented groups? So, when you're doing subgroup analyses, why are you doing the subgroup analyses based on, certain aspects of people's identity? What are you actually looking for? What is your research question asking by separating that out then and then comparing that group of people to, say, a majority group of people, right? And then does the reporting of your results perpetuate marginalization or inaccurate assumptions of those underrepresented groups? Be very careful about, using information to confirm stereotypes and biases, right? And then will individuals from underrepresented groups be able to access your outcomes, and are your results generalizable to a diverse population? Right? We pride ourselves oftentimes in, my research is going to be able to be used all over the world. But the question is, if your population is only, from a, middle to upper class white environment, it probably isn't very globally applicable either. So you need to ask yourself that as well. Who is your research for? And who also has access to it? Just in thinking, if you are doing work, if you are doing community-based research, just a couple of things for you to really think about and consider as well. Especially community-based research really should be collaborative. There is no way that you can work as a researcher siloed without community if you are doing community-based research. And again, I'm going to be bringing up a tool now in the next few minutes or so that will actually kind of speak to this quite a bit as well. Again, researchers work with community, not on community, right? And research is insider research. So again, nothing about us without us. Don't do work on Black communities when you're not doing it with. Your research question should be formulated in there. It should be a research question that they develop that you are trying to answer, not a research question that you are trying to answer that you are getting them to answer for you, right? Collaborative research is ethical research, right? And then research, make sure your research is for social change. Ask what the social impacts are for your research. Now, just a couple of things to kind of leave you with here about EDI and research design and where a lot of the issues lie. Oftentimes I find when I look back at some of this research gone wrong, an interesting thing I like to do sometimes is Google retracted research. You should do that sometimes. Look at some of the studies that have been retracted out of journals and publications, and look at the reasons why it's been retracted. Oftentimes it's because they've used these methodologies that have been really just steeped in so much inequity and deficit thinking about groups, or even done harm to marginalized groups as well. And oftentimes I find that the reasons for that is because of a homogeneous research team. No one on that team, when you think about the example of the pulse oximeter, was there no one on that research team that stopped to say, wait a minute, did we make sure that this actually works on me compared to my colleagues, if I have darker skin? Or, looking at the population that they studied where they validated the tool, did anybody make sure that, we have people with darker skin, because it is something that has like UV light that's got to go through the skin melanin to make sure that it's, valid and reliable for the population as well with darker skin tone? Nobody stopped to say that. Even in the peer review process, think about that. It went through a peer review process. None of the peer reviewers even stopped to ask, how diverse was the population that this device was being tested on, right? And so this is a huge issue in research, where homogeneous research teams really leads to research that can do a lot of harm. Again, historical and non-diverse data sets, if you are using historical data or diverse data sets, historical data sets that you maybe didn't collect yourself, reflecting on that, who is there and who is not there, right? And then, structures that do not value EDI. For so long, and I can say only, I've been working in, research development spaces and looking at research grants for so long now. But only more recently, probably in the last three, 4 years, have I really started seeing funding agencies actually spending money on research for underrepresented groups. Right? It's very recent. And so again, those things that have gotten funded have really been, research topics that have prioritized the majority and has truly neglected those from underrepresented groups and excluded them as well. Again, reliance on historical literatures can and be, I strongly encourage you as well to look into your field and to look at some of the work that people have done and the critiques that people have done historically, especially if you're using really historical data or information, as to how those were formulated. Take an EDI lens to it. Ask who was missing, who was not considered when these frameworks and these concepts were developed as well, and who is it excluding? Your assessment tools, right? Like making sure that the assessment tools that you're using in your research as well are not biased, and the kinds of bias that can kind of come in there because of how the tool was developed. And then, you know, what I find as well is that there's such a misunderstanding and a lack of a knowledge of what equity, diversity, and inclusion is. And, you know, the reality is even, you know, I do a lot of this work again too. My background is in STEM research. So you know, I did a lot of my work in STEM research in sports medicine, but then I kind of moved over to the humanities side when I did my women's studies and feminist research work. And, you know, it was, you know, loved the work that I got to do there. But even there, I saw how certain groups were included in this work and how certain groups were excluded. And so, you know, we must never pride ourselves in being naturally equitable, diverse, or inclusive, or even if your work is in EDI or you work with an underrepresented group, always be humble and understand you may make mistakes, you may misspeak, and you may inadvertently exclude or you know, bring a biased lens to the work that you are doing. So always be willing to be called into this work and stand to be corrected, and understand your privilege and your position of privilege as well. And especially when people from underrepresented groups are kind of calling you out on something, listen, right? Now, I'm going to introduce just like a last couple slides here as I end off. It's a research planning tool that was developed by some former colleagues of mine at Western University, Miriam Haywood and Aaron Huner. It was actually a knowledge mobilization tool that they've developed, and components of it I really love. I kind of worked with them also to sort of add EDI aspects and thinking about when they use this tool to ensure that their knowledge mobilization, knowledge translation plans and impact really considers an equity, diversity, and inclusion lens in it. And so I'm going to present to you just the component of this here today that I hope you will be able to kind of take away with you. And again, too, I'm going to be sharing my slides. So you don't have to vigorously kind of be writing here. But I hope it will be helpful to you. What I'm encouraging you to kind of think of as I present to you these aspects of this tool is that you will look at it as a planning tool for your future. So, you know, I know too, one of the things, you know, for those of us who did our PhDs and so on, you know, our graduate studies a while ago, one of the things I wish someone had said to me was plan out your research program. If you really want to be a faculty member with a research program one day, think bigger than just your thesis paper right now. Stop, even if you just give yourself just, you know, take a day or two, you know, every couple months, or, you know, as you're finishing your PhD, to dream a little bit bigger than where you are at. To ask yourself, okay, so if I'm finishing my master's or I'm finishing my PhD, and I do get to have my own research program, what would that look like? You know, what would my big research question be, right? Where do I see my research program going in the next 2 years? Or what could I imagine for a project like this, right? Expanding and getting, say, like a $25 million grant. What would the project look like if I got $25 million to fund what I want to do? And so, you know, I encourage you here, even though right now, you know, I know you're sort of like in the weeds of trying to finish the work that you're doing, but, you know, take a moment to step out of it and also dream and think a little bit bigger about the potentials for your work and where it could go one day. Because I think sometimes when we start with the end in mind, which is what I'm encouraging you to do here today, we really find benefit later on in this journey. So one of the big parts about this is the research team. You know, it's important to think about who you are surrounding yourself with when building your research program, right? When thinking about the expertise that you want to work with, this is where the networking actually starts. You know, one of the things that I learned early on too, like I said, I was a first-gen immigrant. I had no one really guiding me in my graduate studies process. I didn't even know what a postdoc was, to be honest, until after I was done with my PhD. And so, you know, I had no idea, you know, kind of that I needed to network. Again, too, a bit of my background, I'm originally from Cape Town, South Africa. And the culture that I grew up in, you know, I was told, you put your head down, you be quiet, you don't say anything, you just work really hard and let your hard work speak for itself. When I came to Canada, I literally found out it is the opposite. You lift your head up, you make yourself look bigger and better than you actually are. You network, you speak to people that are way above your pay grade, and you connect with them and you keep in touch with them. And this is how you sort of like get ahead in life here. very different culturally from where I came from, right? And so I didn't know that, the fact that my supervisor sending me to only one conference, actually here in Toronto, so like 2 hours away from London, for my entire 7 years that I was her student was not okay. I had no idea, right? I didn't ask, I didn't question. Only as I was finishing my PhD and I was looking at, maybe applying for faculty positions, was I like, wait a minute, everything I've done here in my career really has benefited her and her publications, not so much myself. I really received no sort of like sponsorship for that next step in my career. Scary kind of part to mine here too is that 6 months before I actually defended my thesis, I was doing a monograph. So one of my papers was already published. Another one was a clinical trial that was completed as well on its way to publication. And, my third paper, and I'd finished writing the paper. And she was like, well, it's not like you need a PhD. You should just quit. Why do you even need to finish it? This was 6 months before I defended my thesis. She obviously had no interest in my career and my potential and where I could go after this. I'd given 7 years of my graduate career to her. I did my master's and PhD with her, right? Only to figure out that, okay, in 6 months, I'm about to graduate with my PhD and I'm about to be an unemployed PhD with really no references. And so, being where I was at, I really learned, I wish someone had told me, Nicole, don't just rely on your supervisor, go outside of that, broaden your network beyond that, and surround yourself with people that could potentially sponsor you as well, and also mentor you in many aspects. So this is essentially sort of like what I want you to kind of think about. So when we talk about knowledge impact and knowledge, and especially knowledge mobilization, right? Like what the end product of your research is going to be, we really need to really think about, actually, like I said, starting with the end in mind. Ask yourself too, like, who are your partners? Who could you potentially partner with? What companies or non-for-profits or other institutions would be interested in the work that you are doing, right? Whom could you partner with? And then too, at the same time, asking yourself, who is your end user, right? So who is going to use whatever it is that you're developing? Who's going to benefit from that? Or who's going to use the knowledge that you're developing at the end? This is to, define your partner types. Ask yourself, is it industry that I need to be working with? Is it, like I said, non-for-profits I need to be working with? Is it academic institutions? Is that really all that I'm going to be working, who I'm going to be working with? Is it, do I need international partners actually for what I do? And what would those international partners look like, right? What would their roles be as well? Also, again, thinking about your end user, what are your end user types? Depending on the research that you're doing, are they patients? Are they actually maybe parents of kids? Or are they the kids themselves that are maybe, I don't know, getting this treatment that you're doing or going to be benefiting from a tool that you're developing? What type of end user will you have? And then what is their role as well? But also, what is their role in your project? One thing that I talked about too was that, especially when you're doing community-based research, it needs to be done in collaboration, right? It needs to be done in collaboration with your partners and with your end users early on. You need to actually start building those relationships first before you actually start to get to, as you can see here, your research question, right? So you need to start with your partners and your end users in mind. And you need to ask yourself as well, who am I doing this work for? Who's going to benefit from it as well? Is it just for me because I'm interested and I'm poking and prodding and I have an inquisitive mind? Or is there actually going to be a benefit to the people that I'm going to be working with or that I'm expecting to or would like to work with on my research project? You need to kind of start with that bigger picture in mind, right? I see this a lot, especially with working with researchers who are applying for really big sort of career defining grants, is that they're so bogged into their research and their passion and what they forget that their work is actually impacting other people outside of themselves. And so, they forget the relevance and also the context within which their research is doing. So never forget the benefit to your partners and to your end users as being a crucial part to your work. Then you develop your research question, right? Only after you've figured all of those out, then you develop your research question. Because what you'll find is that your research question will be informed by the needs of your partners, the needs of your end users, and the interest that you have and the passion you have for this research inquiry, right? And then two, what are the benefits to your research field? What are the gaps? So, just for this Connaught program as well, the impact program scholars, just thinking how, if for those who are doing work sort of in social impact, you are doing your work at such an opportune time for so many of your fields. I can't tell you like the interest that there is in us in sort of the research and innovation spaces now really taking an emphasis on the impact of social impact to our research fields and our research areas. And in this last one, I'm just going to kind of put this here for you as well to consider, developing your project. Think big when you're developing your project goals, right? What is your overall, what is sort of like the big picture, pie in the sky, world problem you're going to solve? What is your overall project goal? And then you can kind of work towards like, okay, what is my short-term goals and how I'm going to fulfill those? And then you might even be able to develop, different projects from those short-term goals as well that will really develop your research program and, give you that sort of thinking about that long-term impact and the long-term goals that you're going to then take that impacts that overall project, pie in the sky project goal that you were looking at from the beginning as well. So I encourage you here to think big. Then also think about the impact, right? And especially when you think about sort of project outputs and project outcomes, who is it impacting? Is it only impacting on a homogeneous population? Or is it really for a globally diverse world? How will people from different backgrounds you be able to use or access the work that you are producing? Is it relevant to them? Or is it not relevant to them? Have you asked yourself how those from underrepresented groups would be able to experience or, actually apply the work that you are producing as well in this way? Now, just a couple of things here as I leave you with this, but some changes that we've really seen that I want to kind of bring to your attention. And like I said, why this work, if you're doing work in social impact, is so crucial is that, social impact work is already naturally interdisciplinary. And we've really seen over the past few years a greater emphasis on the importance of interdisciplinary work. Knowledge mobilization, knowledge translation, and impact has also been very crucial. So developing a knowledge mobilization plan, like I said, having your end user in mind, having your partner in mind, and the benefit that it will bring to them, which is your knowledge mobilization, knowledge translation, right, is also crucial to this work. EDI, taking this lens and this aspect of it of who is your work for, who does it impact, who's included, but also who's excluded, right, will truly bring up again too the social impact aspect of it in many ways. So as I close here on my last slide, I just want to encourage you all to be transformative leaders in the work that you do and in the spaces you find yourself in research. We truly have a responsibility, right, to this work in this way. You need to know yourself and reflect on the complex and your own complex and intersectional identities and how this impacts your field and your area. We need to be critically self-reflexive about power and privilege in ongoing ways. And then we also need to have the brevity to be able to challenge stereotypes and essentializing constructs of ourselves and others, especially those from equity deserving groups. It's about, being a transformative leader is about being willing to also critically assess our own biases, our assumptions, our expectations, intentions, and impacts of our choice, and how they may unintentionally and negatively impact others, with special attention, again, to marginalized groups. Being a transformative leader is also about being conscious of our strengths and our weaknesses and seeking support when matters fall out of our expertise. It's about knowing and expressing our agendas and our non-negotiables as well in these spaces. And then supporting critical conversations, including conversations around privilege, racism, colonialism, and sexism, and so on. And then intervening when conversations become unsafe or assumptions need to be troubled. I strongly encourage you to be an ally in the spaces where you find yourselves for equity, diversity, and inclusion. And thank you very much, everybody.